St Thomas's Hospital in London has just launched the UK's first one-stop multidisciplinary clinic for headaches. It's designed to offer rapid access to specialist care for people whose own doctors are struggling to control their symptoms. And sometimes those symptoms can be very disabling, particularly in cluster headache, which affects more than 100,000 people across the country. Consultant neurologist Dr G Lambru heads up the clinic, and we went to St Thomas's to meet one of his patients.
Hi, my name is James. I come from Norwich. I have a high-pressure sales job, and I've come down to see Dr Lambru to help me get rid of my cluster headaches.
So, can you describe us what the first feeling was?
It's difficult to explain. It feels like kind of a tingly sensation. I feel like I need a drink of water. It's almost like a burning beforehand, right about here behind my right eye socket, and then once it kicks off, obviously, I can't really control anything. I'm usually bashing my head about, or trying to pinch as hard as I can here.
And you experience also some facial symptoms, right?
Yeah. I usually get like a little droopy eyelid, just drops down a bit there, and usually this side of my nose is really congested.
Giorgio, what's happening in cluster headache?
Cluster headache is a devastating condition. It's a headache disorder whereby patients, usually males, experience a one-sided headache that normally lasts between a few minutes up to 3 hours. And it happens several times a day during what we call the cluster headache bout, which is normally a period lasting between 4 to 6 weeks. That happens following some seasonal patterns. So patients with episodic cluster headache, as we call it, tend to have periods of daily multiple cluster headache attacks that normally occurs at specific time of the year, normally the change in season, whereby they experience a one-sided headache, this terrible pain normally centered around the eye, and is associated with these facial symptoms.
And the name cluster presumably comes from the fact that you get days of it one after the other. They're all clustered together.
Yeah, so you can have between one episode every 2 days up to 8 cluster attacks a day, every day during the bout. And then everything stops dramatically. People become completely headache and pain-free. And that is what normally delays the diagnosis. Because when they go to primary care doctors, they're given some painkillers, then the pain goes away spontaneously, and people think that they've cured them. But then the following year, everything happens again.
Well, if it's happening the next year at the same time of year, what do we think is triggering these headaches?
Yeah, we think that the mechanism, the pathophysiological mechanism underlying cluster headache lie into a structure that is the so-called body clock pacemaker of the body, which is the posterior hypothalamus, which is a very, very tiny area in the middle of the brain that for some reason gets abnormally activated. And it seems to be responsible for the seasonal pattern of these attacks.
Is there any link with migraine, which people will be far more familiar with? Because there you get a headache and you can get some other odd symptoms that accompany that.
The people with cluster headache about 30% of them tend to also have migraine or migraine. In terms of gender, migraine is more prevalent in female rather than male. So normally what happens is that female with cluster headache are always or quite often misdiagnosed as having migraine instead of cluster headache. Certainly the activation of the nerves that provide the pain through the face, that is in common with migraine, and there is a proportion of cluster headache patients that can experience the so-called migraine symptoms like nausea, light sensitivity, noise sensitivities. But in cluster headache, all these symptoms, especially the photophobia as we call it, and the phonophobia are lateralized, or strictly on one side, and that can sort of discriminate between the two conditions as well.
George, I was going to ask you how bad these headaches are, but perhaps we'll give the first word to James to hear how his are.
The only thing you can really compare it to is if you get your thumb on your right hand and you shove it up behind your eye as hard as you possibly can. People liken it to like a hot poker being rammed right in your eye. If I get them and I can't get rid of them, they can really do me some damage, not just to my mental well-being, but obviously sometimes you just physically have to bash your head against the wall to get rid of them. Not very helpful, but yeah, they are horrific.
Giorgio, the pain can be bad. He's not exaggerating, is he?
No. It's a very dreadful type of pain. Cluster headache is also called a suicidal headache. Women consider it more painful than giving birth. And the studies that have been carried out have all shown that is one of the most dreadful pain conditions. So I think the description is pretty consistent with other patients.
What's the natural history of the condition? I mean, when do people start to get them, and what happens to them if they're left to their own devices? Do they go away again?
Cluster headache normally starts at the age of 30, early 30s, so slightly later than migraines. And the vast majority of patients have the so-called episodic pattern with bouts of attacks alternating with remission periods. And then there is a 10-20% of them that actually happen to suffer with a chronic form with attacks that occurs relentlessly without any remission. These, of course, are the most disabled patients. The vast majority of people with episodic cluster headache continues to have episodic cluster headache. There is a proportion of about 20% that goes into prolonged remission for years, and then the pain comes back again. When it comes to the patient with chronic cluster headache, the vast majority of them, I would say, continue to have chronic cluster headache. But there is a small proportion, possibly due to treatment, that actually goes back into the episodic pattern.
What can you offer people like James in form of relief?
The management of cluster headache involves certainly abortive treatment, so treatment that can stop the pain as soon as possible. Because unlike migraine, I would say in cluster headache, you cannot wait. You have to offer something that works within 5 to 10 minutes. And sumatriptan injections certainly do, as well as high-flow oxygen. And then for those with prolonged bouts of attacks or with the chronic form, there are some preventive pharmacological approaches. Verapamil is one of them, which is one of the few medication with randomized control evidence. And verapamil is a medication that is used in cardiology, but in cluster headache seems to be quite effective, especially at high doses. And there has been some hypothesis that the verapamil can modulate the calcium channels in the hypothalamus.
So it's affecting the brain chemistry in some way, we think.
We think.
So what's the classic mistake that's made out in the community before people come and see a specialist like you? Is it it's confused with migraine?
Yeah, so it's confused quite often with migraine. Other people confuse it with a sinus problem because the pain can actually radiate to the face, maxillary sinuses. You have the runny nose and runny eye, so why not a sinusitis? And other people see dental specialists or maxillofacial surgeons because the pain can radiate to the teeth and the gums. They get lots of dental treatment with no effect.
What was the idea behind the one-stop shop? What was the need that it was meeting that wasn't there already through a conventional headache clinic?
The main need from patients is when they get into a bout, we don't think that they can wait that long. So we would like to offer them a very quick appointment where we can confirm the diagnosis, give them a treatment as and when, and then to offer all the possible treatments on the day of the assessment.
Yeah, that must be fantastic for patients like James, because, I mean, a week, 2 weeks, 6 weeks, a 6-month wait, which can be quite common in these sorts of clinics, is terrible for somebody who's suffering that much.
And you can imagine if you have a bout that lasts 6 to 8 weeks with 6 attacks a day and you're seeing 6 months after when you're pain-free, is completely pointless.
Dr G Lambru and his rapid access cluster headache clinic, which can only be accessed by referral from a GP or another specialist. And I suspect it might be busier after this programme. More details on the Inside Health page of the Radio 4 website.